Turn our attention now to the Hantavirus outbreak on a cruise ship. We can show you new video from just a few hours ago. 17 Americans exposed to the virus on the MV Hondius landed in Omaha, Nebraska. That's what you're watching here. And one of them tested positive en route. A French passenger has also tested positive after being evacuated from the ship, which docked in the Canary Islands yesterday. CBS News foreign correspondent Ramy Inocencio joins us from Tenerife. That's one of the Spanish islands of the Canary Islands. Ramy, you got some fast-moving developments this morning. What can you tell us?
Errol, yes, absolutely, and good morning. Health officials here told us that none of the passengers and the crew, about 150 of them, had any symptoms whatsoever when the Hondius sailed in here yesterday. You can see right behind me. But now 2 have tested positive for hantavirus. This is according to the United States and to France, and we know now they are already back in their home countries.
Just before sunset last night, passengers from the United States were the last to be taken off the hantavirus-stricken cruise ship on the first day of evacuations, wearing masks and PPE, echoing COVID times. We caught closer glimpses of them as buses whisked them away to this specially fitted Boeing 747 deployed from Atlanta, on the ground here for barely 3 hours, then in the air on the way home. The end of more than 16 hours of evacuations after the Hondius dropped anchor.
We reach you loud and clear, over.
Passengers from 14 different countries in planes prepped for containment. Like these negative pressure biocontainment pods used for Ebola and the plague, in which 2 Americans traveled to the United States. In mid-flight, one tested mildly positive for hantavirus, a second developed symptoms. Health officials here in the Canary Islands re-stressed this is not a new pandemic. We asked the chief of the World Health Organization, Tedros Ghebreyesus, this.
What is your message to Americans who are still scared?
We have been repeating the same question, the same answer many times. This is not another COVID. And the risk to the public is low. So they shouldn't be scared and they shouldn't panic.
And there is concern out there that more positive cases could pop up as passengers from that ship keep fanning around the world. As for that second confirmed positive hantavirus case, that is in France. We understand that that person's case is rapidly deteriorating. Errol.
All right, Ramy Inocencio, live for us in Tenerife. Ramy, thank you. Dr. Céline Gounder joins us now. She's a CBS News medical correspondent and the editor-at-large for public health at KFF Health News. Dr. Gounder, good morning. Welcome. Great to have you here. First, help us understand, as we mentioned in the open of the show, what mildly positive means. It's not a phrase we've used before.
Mildly positive is like mildly pregnant. So this person is positive. They have hantavirus. The question is, where in the course of their infection are they? And they're probably very early. Remember, this is a virus that has a very long incubation period, meaning it takes time before you start to see the virus grow and take off and for you to develop symptoms. So most likely, this is somebody who's very early, who may well get much sicker in the coming weeks. And we should absolutely anticipate more cases in the coming weeks because this is a virus that has a very long incubation period. That is not something to be fearful about. That is not cause for alarm. That is to be expected.
Right. And that was my next question, because so many people, and you've mentioned this last week, it may be echoes of COVID and PTSD people have from that. They're so fearful over this. But what will happen to these passengers who are now in Nebraska? And the fact that this one person tested positive en route, is that proof that this procedure is working and that everyone was isolated?
Well, the good news here is because of that long incubation period, that gave us more time. COVID, what we have circulating now, has an incubation period of just a couple days. And so you don't have much time to isolate somebody, to even control it. Here we had the time. So again, a reason to not have alarm about the situation. So in terms of what people are going to be doing once they arrive in Nebraska, it's really about assessing, stratifying their level of risk. Are they high risk or low risk? The CDC has come out with some guidance, which ironically is quite similar to some of the early COVID guidance about the 6-foot rule. So if were you in an enclosed space within 6 feet of somebody for 15 minutes or more? And frankly, it's a little bit arbitrary. And based on what we know of Hantavirus is probably a fairly strict definition of what is high risk. In fact, probably you need more exposure than that to be truly high risk. But that's how they're defining that cutoff. And then if you were high risk, you have the option of staying on at the facility in Nebraska or isolating at home. Low risk people are to isolate at home. Health departments will be following if you are in the home. One of the key things is, can you isolate away from other members of the family if you start to develop symptoms? Health departments are responsible for making sure you have access to the necessary hospital care, in particular heart-lung bypass machine if you get much sicker. And oddly, people are allowed to travel, which I was a little surprised.
Okay, so people should not be freaked out, it appears, for the moment. This procedure is working and these folks will be isolated in Nebraska, so stay calm if you can. Dr. Gounder, great to have you here this Monday.